are, it is also important to know how to care for a choking child and how to remove a foreign object airway obstruction. However, you should not confuse a foreign object airway obstruction with airway swelling resulting from an infection such as a cold or bronchitis. In this case, there may be a barking cough, and you should transport the child immediately to the nearest hospital for treatment. Choking or foreign object airway obstructions can be caused by foods such as hot dogs and peanuts and hard candies, or small toys such as beads and marbles. To prevent injury, you should never practice actual airway obstruction rescue maneuvers on another person. This is why we are only simulating them here or using a mannequin. A child's airway can either be partially or completely obstructed by a foreign object. When the airway is only partially obstructed, the child can cough strongly and make wheezing sounds between coughs. At this point, do not interfere. Forceful coughing may be enough to expel the foreign object. If the child cannot expel the foreign object, poor airflow may develop quickly. Signs of poor airflow are a weaker cough, gagging, high-pitched noises while inhaling, noisy breathing, and bluing of the fingernail beds, the lips, and the skin. These signs should be treated as a complete airway obstruction. When a child has a complete airway obstruction, use the Heimlich maneuver. The Heimlich maneuver consists of a series of manual thrusts given to the abdomen. This maneuver is performed the same whether the child is standing or sitting. You can determine if the airway is completely obstructed by asking the child if he or she is choking.
Are you choking? Are you choking?
When the airway is completely obstructed, the child will not be able to speak, breathe, or cough, and you must immediately act to relieve the obstruction. Stand behind the child and wrap your arms around the waist. Make a fist with one hand. Place the thumb side of the fist against the center of the child's abdomen, midline slightly above the navel and below the rib cage. Make sure you are below the tip of the breastbone and the margins of the rib cage to prevent injury to the child. Then, grasp your fist with your other hand. Press into the abdomen with quick upward thrusts. If you are unable to relieve the obstruction and the child becomes unconscious, call out for help. If someone arrives on the scene, quickly send that person to call for emergency medical help. Obtaining emergency medical help is of the utmost importance. The unconscious child must be positioned lying flat on his or her back on a firm, level surface. If the child must be repositioned onto the back, support the head and neck with one hand and carefully roll the entire body towards you without twisting it. Next, check for the foreign object airway obstruction using the tongue jaw lift maneuver. To do this, keep the child's face up. Grasp both the tongue and lower jaw between your thumb and finger and lift upward. Look into the mouth and remove any foreign object that you can see. If you cannot see the foreign object, or you are unable to remove it, then open the airway using the head tilt, chin lift. Determine if the child is breathing by listening for breathing, looking for chest movement, and feeling for exhaled air on your cheek. If the child is breathing, continue to keep the airway open until help arrives. But if you don't hear breathing, feel exhaled air on your cheek, or see the chest rise and fall, you must keep the airway open and attempt to give a rescue breath. Pinch the child's nostrils, take a breath, open your mouth wide, seal it over the child's mouth, and give a rescue breath. If the chest does not rise, reposition the head, reopen the airway, and attempt another rescue breath. You may still be unable to give a rescue breath to an unconscious child because of the obstructing object. In this case, position yourself kneeling at the child's feet. Now begin the Heimlich maneuver. Place the heel of one hand on the abdomen, midline slightly above the navel, but below the rib cage, to avoid injuring the child. Then, put your other hand on top of the first hand. Press into the abdomen with quick upward thrusts. For a small child, the maneuver should be done more gently. After doing the Heimlich maneuver, repeat the tongue-jaw lift and look into the child's mouth to check for the obstructing object. After checking for the obstructing object, attempt to give another rescue breath. If not successful, continue the sequence of Heimlich abdominal thrusts, tongue-jaw lift, and rescue breath attempt. If you are able to remove the foreign object airway obstruction, make sure to check the child for breathing and pulse. If breathing and pulse are absent, start CPR. Even if CPR is not needed, a physician should still examine the child immediately.